Hi team, my name is Ali. I'm the emergency consultant. We've got a sick patient. He just with altered conscious state, just retrieved from the beach and then collapsed. So I just would like to prepare my team, and I just would like to take a focus history from his friend. So can I introduce your team, my team, please? You are James, thank you. Beck, thanks, and Beck. Okay. Team, I just would like to allocate the roles. I just would, James, I would like you to be the airway assessment. Are you airway competent? Thank you. And Beck, I just would like you to do the circulation for me, and if you can scrub, or also I'll allocate another task for you as well. So what we would like to do is, once the patient arrive, James, I would like you to assess his airway and breathing, do the primary survey. And Beck, I just want you to have get an IV access both sides. I would like you to take a venous blood gas, blood sugar, and full blood count, UEC, LFTs, coagulation as well. And once the result back, please just let me know about it. So I just need 30 seconds just to get some history from the patient's friend. He was at the beach. He was swimming, get out of the beach, and then he collapsed. He's got type 2 diabetes, he's type 1 diabetes, he's on insulin, no major health issues, no allergies, he's otherwise healthy man. Okay, so what we would like to talk about here, team, we need to think about what's could have caused that. So I'm just thinking about marine envenomation, most likely box jellyfish or a kanji. Maybe he's got ischemic events like AMI, arrhythmias, tachyarrhythmias, intracerebral bleed, meningitis, encephalitis, or he may have a seizure, intracranial pathology like a bleed, as we say, or maybe drug-related like methamphetamine or substance abuse as well, and also metabolic, whether if it is hypo or hyperglycemia or hypernatremia. James, let's do assess the airway. Is he able to maintain the airway? Is he obstructed? No? Okay. Can you listen to the breathing? Can you just tell me what you could hear? So he's got bilateral breath sound, a lot of crackles. Okay, so is there any decreased air entry or pneumohemothorax that you would suspect? No. Okay, so Beck, I just would like you to organize a chest X-ray for me, and I would like you to, James, put an oxygen mask, maintain saturation, my aim 94% saturation. Now with the circulation blood pressure, 220, so this is very high, so I would like to address that. I just would like him to, Beck, would you please just get me some GTN patch and then try to prepare infusion for me. Let's go with the exposure. Has he got any pupils, equally active, and there's any acute neurology that we could see? Okay, temperature, and then is there any skin manifestation of any problems, bruises? Okay, so as we can see, he's got a cross hatching. This is more consistent with box jellyfish envenomation. Let's try to get Beck, please, if we can get some vinegar, just plenty of vinegar, just put it, and if you can just remove the tank tills for me. I just would like to organize an antivenom, if you can just organize this for me. Now, have we got any blood gas results yet? Okay, so looking at the blood gas, he's got severe respiratory acidosis evident by pH of 7.2, and PCO2 is high, so we have got ventilation problem. So I think this patient, we need to proceed with rapid Sigwas induction to protect the airway, and also GCS is 8 as well, so he's got 2 indication. So let's prepare team for the intubation. So I would just like to go plan A, maximize the pre-oxygenation and position. We'd go direct laryngoscopy with the bougie, or rather that's if you have it here. Plan B is just good alarm A if that's failed, and plan C, would like to awake fiber optic if it doesn't, if it's still able to ventilate. And then if we have got into critical situation, then we have to do a surgical airway. At this point of time, I just would like to get all the team together. So guys, we're dealing with most likely box jellyfish envenomation. At this point of time, he's hypertensive. We're addressing that. We would like to control his airway by planning to have a rapid sequence induction. So do you have any question at this point of time, or is there anything that's need to be addressed? Good. So let's prepare for intubation. We'll go for the most experienced. So the first go is the base go. I just would like to pre-oxygenate. I would like to have a good sort of positioning of the patient. We need to prepare our equipment. So that's the size 7.5 tube. I need a bougie. I need full physiological monitoring, end-tidal CO2, and oxygen, suction, tape for the tube, and then we would like to apply post-intubation care. So then once we put the tube in, we'll go for A to ABCD assessment, and we'll do 12-lead ECG as well. We'll do a chest X-ray post-intubation. Would like to get an IDC, check his urine output, and also put an nasogastric tube as well to prevent him from having any minimize the risk of aspiration. We need to notify the friend and the family and update them. We'd like to organize a disposition for this patient. I need to speak to the ICU as well, and take it from there. If there's any questions, if there's any issues that need to be addressed, please just let me know. Thank you, team.